And we have a Goan doctor here with us, absolutely live in the studio. And as I have been mentioning, right from 2:30 p.m. onwards, with World Alzheimer's Day around the corner, we bring you a chat right now, absolutely live with Dr. Teresa Ferreira, head of the Neurology Department at GMC Bambolim. And she is here absolutely live with me in the studio. Hi, Doctor. Good evening.
Hi, Velma.
Happy that you've made the time for us. I know you're really, really busy. Thank you so much for making the time. And I know you've had to really rush and come. Thank you so much.
My pleasure.
So we'll talk all about Alzheimer's and various queries. People have been sending a lot of messages and questions, but 4:21 and 9 seconds down on this edition today at this time. We have with us Dr. Teresa Ferreira, head of the Neurology Department at GMC Bambolim. And remembering is something that many people who suffer from Alzheimer's, they have a problem with remembering. So I have Doctor here with me. Doctor, if you could tell us what exactly is Alzheimer's?
So Alzheimer's is a type of dementia. And it was described by Alois Alzheimer's in the initial part of the 20th century. Now, dementia, as we understand, for us to function as human beings independently, we need a lot of faculties. It is not enough to remember. We need to know to modulate our behaviors. We need to learn how to interact with people around us and how to react to the stimuli from the surroundings. Okay. We need to know how to move around in our surroundings, okay, by being able to locate ourselves, our positions. So dementia is basically a loss in these our higher mental faculties as human beings. Okay. And when we lose these higher mental faculties to a degree which starts interfering with our ability to manage ourselves independently, that would be sufficient to diagnose a person with dementia. Okay. So dementia is not equal to only losing memory. There is much more to dementia than memory loss.
Okay. And doctor, then so Alzheimer's is just one type of dementia.
Yes.
Right. Okay. This is for lay people, all of us lay people who are tuned in also. So what are the signs and symptoms that suggest Alzheimer's?
So Alzheimer's can present, the most common way of presentation of Alzheimer's is a gradual memory loss. So the very initial symptoms most patients will complain of is difficulty in remembering names of people. Okay. Difficulty in remembering things, names of things. So they have difficulty in recollecting. Then next they have difficulty in recollecting things and that they have read about or they have heard about recently. So there is a recent memory loss. So they have a difficulty in encoding new memories. So in our process of remembering things, we can remember things for a second, for minutes, for hours, and forever. Okay. So our memories which we have built over the years as children and as young adults are very strong memories. They are long-term memories. Yeah. But the everyday of what somebody has told you, what you have read, what you have eaten, those are the short-term memories. And these need to be consolidated over time to become long-term memories. Okay. So these patients of dementia have difficulty in consolidating these memories to become long-term. So they have difficulty in learning new knowledge. So what they read, they tend to forget. What they have heard, they tend to forget. Okay. And gradually this memory loss increases, and over time they start forgetting even things which were in their long-term memory. And gradually the memory gets wiped off gradually from the middle years to their younger years. So that's why their memories as children are the strongest. So they have a lot of their life finally as a patient of dementia progresses, they will have memories of their childhood.
Oh, okay.
And many a times patients relative or caregivers say that their patient feels that he is not living in his home.
Okay.
that he wants to go back to his parents' house.
Okay.
Although he might, means he feels that surrounding is new to him. That is not his home.
Okay.
If he has moved out of his parents' house to a new house during his lifetime,
Mm-hmm.
so as the memory loss progresses, patients have difficulty in, they cannot remember. So they remember only their childhood.
Oh, okay. They're not something that has recently happened.
Not something that has happened in the previous 10 years or 20
Okay.
years or 30 years of their lives. Yes, so besides memory loss, patients have difficulty in planning and executing their functions. For example, a person who would normally carry out a certain set of duties, for example, going to the markets, paying their bills. So they will have difficulty in planning this out. So when they go to the market, they will not remember what they have come for. One of it is memory. Secondly, they will have difficulty in finding their in the usual places where they would buy different items. They will get disoriented in space. They cannot place the shops where they would usually buy, so they get confused.
Okay.
Also, these patients tend to lose their way. They lose their way because they are unable to locate themselves in their surroundings. So they tend to lose their way many a times.
Okay.
They misplace things at home.
Mm-hmm.
Also, they have a lot of behavioral abnormalities which usually come in the second stage. These behavioral abnormalities could be of suspiciousness because they lose their items. They feel that somebody has robbed their items. Someone is making their things disappear.
Okay.
And very often they have these anger outbursts, and many a time these anger outbursts are directed towards the main caregiver.
Oh, okay.
Also, some types of dementia other than Alzheimer's, some may have even they may have hallucinations,
Okay.
wherein they imagine seeing either people who don't exist around, or they can see animals around them, or they can see other creatures around them.
Okay.
Or besides these, patients may have difficulty even in carrying out simple activities like having a bath, changing their clothes, or even brushing their teeth.
Okay.
So this all happens over a spectrum, over many years in Alzheimer's dementia.
Okay.
It can span over a period of 10 to 15 years. In a gradually progressive Alzheimer's dementia. But in some types of dementia, this whole progress may be much faster.
Okay.
It all depends on the cause of the dementia.
Okay, and doctor, if I may take a question, there is a listener called Elvis from UK who has sent this message earlier on, and he said, I always wanted to know the first signs of Alzheimer's disease and at what age do they normally occur? He's directed the question to you. Doctor.
Yes. So Alzheimer's is seen more commonly as age progresses, and it is more common after the age of 60. And every 5 years, the prevalence and incidence doubles. So, and above the age of 80 and 90, it is extremely high, the incidence of Alzheimer's, and that's why we see much more Alzheimer's today, with our populations living longer. But Alzheimer's can happen before the age of 60, when usually there are certain genetic factors predisposing, and there may be a family history. So we have, there might be Alzheimer's as early as 45, 50 years of age, but most commonly it is above the age of around 65.
We've been talking for the last couple of minutes, and doctor, if you could tell us, what does a person do when they experience the symptoms? You know, you spoke about the symptoms a few minutes earlier, or rather, how do you diagnose a person suffering from Alzheimer's?
Yeah, so the diagnosis of Alzheimer's still remains very clinical. It's a clinical examination, a detailed clinical examination that will make the diagnosis and be able to guide the patient and their relatives as to the management of the condition. So aims of when a patient goes to a patient needs to see a neurologist first of all, and the neurologist does a series of examinations to test the cognitive functions, the rest of the nervous system examination, as well as the systemic examination. So the aim of this is to find out, to eliminate all the treatable causes of dementia. So there are some causes of which can cause memory loss, which are fully treatable and they are reversible. So that is our first aim. Secondly, we have to separate out other neurodegenerative conditions. These are not treatable, but their management differs from Alzheimer's. So we have to try to see if the patient is a case of those neurodegenerative disorders rather than Alzheimer's.
Okay.
And third is, after we have eliminated all the possibilities and we confirm the diagnosis of Alzheimer's, is to know at what stage of the disease the patient is. And as per that, institute treatments to see if we can slow down the process of degeneration and help the patient in their day-to-day functions, as well as guide the family in taking care of the patient.
Okay. And doctor, then how does one know, there must, in a family, how do the others know that their loved one, the patient, is at, let's say, a particular stage of Alzheimer's? I hear there are different stages, right? So is it possible to find out?
Yes, it is by clinical examination of the cognitive functions and the nervous system examination that we are able to say whether the patient is in stage 1, stage 2, stage 3. That is more important for the doctor because of instituting treatments and to know, and also to be able to prognosticate to the family as to how things are going to follow over the years and what to expect to prepare them.
Okay. So talk of that, we have about 25 minutes more with you and me together. Shall we talk about the treatment right away? I mean, I was wondering if you could tell us about what treatment options are available for Alzheimer's.
Yes. I'd like to make a mention here that before a patient actually starts experiencing cognitive deterioration enough to interfere with his function, there is a phase before this which is called as mild cognitive impairment, wherein the patient appreciates that he's not able to remember as well and not able to function as well. But he's able to do all his activities independently, including going out, driving. He can do everything. But the patient starts experiencing difficulties. And this is at the stage at which we need to diagnose the disease. Because instituting treatment at this stage can slow down the process of worsening and can slow down the deterioration. So the treatment is best instituted at this stage. So the medication which are helpful in Alzheimer's disease, which are a few drugs which are available, they are not curative. There is no cure for Alzheimer's till date. So the treatments which are available need to be instituted in the mild cognitive impairment stage or the stage 1 of Alzheimer's. Once the patient is already in stage 2 to stage 3, the benefits of treatment are not too great. So memory loss, what is lost, it does not come back. So we need to slow down the degenerative process. Secondly, we also need at all stages to treat all behavioral problems of the disease. And more importantly, in stage 2 and stage 3 is guide the caregiver. Because the caregiver, it's a big burden on the caregiver to, many a times the caregiver is the spouse. And they are also at an advanced stage. And it is difficult to see their loved one deteriorating in front of their eyes and becoming more and more dependent. And their ability to take in all of it and understand it is quite difficult. So we need to help them in doing so. We need to help them with the behavioral manifestations so that they can take care of the patient, because sometimes these patients can get very aggressive and even physically aggressive. So these patients sometimes need to be calmed down with medication. So that needs to be done way into stage 2 and stage 3.
And doctor, we've been talking about Alzheimer's, and if you could tell our listeners, how do we prevent dementia?
Yeah, so although we spoke about that dementia does become more frequent as we grow older, but there are many studies done in various continents have shown that there are certain risk factors that bring on the disease earlier than expected. Among these, the risk factors that have been seen throughout all the continents have been, one is that the level of education makes a difference. The lower the level of education, the earlier the onset of symptoms of dementia. So pursuing higher education And also it is not only the education at the level of school and young adulthood. It is education throughout life. So we need to keep learning to do new things and trying to involve ourselves in new activities to stimulate our mind. Also, all the other risk factors that are associated with cardiovascular disease, like hypertension, diabetes, obesity, decreased physical activity, are all the risk factors for dementia too. And it has been proven that a better control of high blood pressure, sugar control, increasing physical activity, and reducing obesity are associated definitely with a later onset of dementia. With increasing age, we also have a higher incidence of hearing loss and visual loss. These are again associated with a higher propensity to develop dementia because of the decreased stimulation. So a person who cannot hear has decreased interaction with other people. And that is one. And social isolation is one of the risk factors. So we need to do all measures to prevent social isolation, which is, if there is hearing loss, hearing aids, if they can help early on. Visual loss, if there is cataract, that's why it is so important to pay attention to cataract developing and other causes of visual loss and treat them in time so that the person does not get withdrawn from societal contact. The other risk factors that have been recurrent head injuries. So in Goa, where we have lots of head injuries, we need to wear our helmets, and also we need to have temperate habits in the form of reduce smoking and reduce the consumption of alcohol, because both have been associated with a higher risk of developing dementia. When I talk about alcohol, I talk about a large amount of alcohol. A significant and on a daily basis intake of alcohol is found to be a risk factor for dementia.
Okay, doctor. So are there any more?
There's another very important risk factor which we see nowadays and in our Goan society. Although Goan society was a very close-knit society, we are becoming the society has changed a lot. So the elderly people tend to feel very isolated and they live in a lot of loneliness. And this is one of the risk factors which probably will contribute to an increasing incidence of dementia in our society. So we need to have at the community level, we need to people to understand about dementia and have activities at our villages and cities so that we can bring people together, especially people who live alone, so that they can maintain contact with the rest of society and not get socially isolated.
Okay. A listener of ours, Sham Sundar, I think he's from Mangalore, and he has sent in a message where he says, senile dementia is a progressive disease that destroys memory and blocks mental functions. This requires various in-depth medical diagnostic methods, expert and well-equipped laboratory tests or imaging, and are important. So how much has our Goa Medical College prepared for this, and is there anything and what is lacking? And the Ishkola Medico Circujik, the Goa was one of the topmost hospitals in Asia, established in 1842. That's some information also he's added for us. But he's asking how well is GMC prepared?
Yes, Goa Medical College is fully equipped with all the investigations, blood, the MRI, the electroencephalography, whatever investigations we need to make a diagnosis of the type of dementia. Yes, we do have it.
Okay.
Nowadays, there are newer treatments which are being tried out for Alzheimer's at the research level. Now, those need some further certain special scans. Those we still don't have, but hopefully in the years to come, we will get that too.
We have been talking about, with Alzheimer's Day around the corner, we've been discussing about that for quite some time now. And now, Doctor, we come to the role of one of the most important people in the lives of an Alzheimer's patient, the caregiver. What are the do's and don'ts for a caregiver?
Yeah, the caregiver is an extremely important person in the life of a patient of Alzheimer's, and the person who takes the burden. The biggest burden of the Alzheimer's is taken by this caregiver. It is important, first of all, that if possible, as far as possible, if there can be many caregivers, in a family, if there can be more than one contributor, it is very, very beneficial rather than a single caregiver, because to share the burden of the years of the disease. This disease can go on for years, and it is never Alzheimer's that takes away a patient. It is as they get older, they tend to get slower, they tend to get more rigid, they tend to have more falls, they tend to be more susceptible to infections, they have difficulty in swallowing. Then with the pneumonias and the infections and the falls, that is what takes away patients of dementia. So it is all lies in the care that the patient receives. But the caregiver has to be able to take care of himself or herself too, to take the patient through these years of the disease. So for a caregiver, especially in the initial years, in stage 1 and stage 2, right from the beginning, it is important to establish routines. Having a routine as to a fixed time of waking up, a fixed time for meals, a fixed time for a bath, a fixed time for physical activity. There has to be exercise in the life of a patient every single day. There has to be interaction. The person you have to talk, and ideally this conversation with a person with dementia is best done with few people. They get lost in when there are too many people around. The second problem that caregivers often face is when patients of dementia start getting aggressive. Now, during the aggressive phase, it is important to be calm. However difficult it is important to be calm, to let the person speak. If the person is troubled about something, is to say it in a very calm voice. If the patient accepts it, all right. If the patient does not and keeps repeating the same thing again and again, sometimes it might be an allegation. So it best is just to keep quiet, be around, and the patient will gradually calm down. Only do not allow the patient to get hurt or harmed if in case the person is physically aggressive, or the caregiver should not get harmed. If these incidents happen too often, then the patient will need certain medications to calm them down. Unfortunately, too much of medication also can be, too much of medication to calm them can work adversely to slow them down faster than expected. The caregiver also needs to take care of themselves, so they need to find some time in the day for things that they enjoy, because many a times their life is so surrounded by taking care of a patient with dementia that they totally forget about themselves, and that also has long-term consequences in their lives. So it is important that they have some time to enjoy certain things which they like to do. And we need to build dementia-friendly communities around us, so for people to understand. And if a society can also share in with the caregiver and help manage a patient of dementia, that would be much better. We still don't have dementia homes, which are important, which are halfway homes where patients can be kept for some hours in the days to do certain activities so that the caregiver gets a break. But this is the need of the hour. We have to build dementia homes so that we will be able to handle all the increasing number of dementia patients in our society.
Doctor, and talk of which, in fact, right now, there is a person, Vijay from Benauli, who's asked a similar question related to what you're talking. He says, good evening, Dr. Teresa. Are there any support groups related to dementia in Goa?
Unfortunately, we don't have dementia groups throughout Goa. There is one group, it's a senior support group in Panjim, but we do not have dementia support groups as of now in Goa.
One final question. What message can you give to all our listeners who are tuned in on the occasion of World Alzheimer's Day?
So first is we need to take care of ourselves. We need to never stop learning, never stop being students our whole life, however old we get. Secondly, we need to always, all the risk factors, that is, we need to prevent obesity with healthy eating habits, having a good physical activity and some form of physical activity every day. Diagnose hypertension and monitor hypertension and see that blood pressures are always under control. Control sugars for people with diabetes.
Okay.
And besides taking care of ourselves, we need to build dementia-friendly communities. So we need to, all of us, to understand what is dementia and help to prevent dementia in our societies by increasing interaction among our people and reaching out to people who live lonely lives and people who have members in their family with dementia,
Okay.
to share in their burden and to make the life of that dementia patient also a better life, improve the quality of life, because it is many years of the disease and it's not easy.
Okay.
The journey is difficult.
Thank you so much, Dr. Teresa. Thank you so much for coming here, for making the time. And
thank you very much for having me here.